Are you looking for relevant healthcare information? Log on to Medicircle and watch experienced medical professionals talking on common healthcare topics. Stay informed, stay healthy, stay tuned to Medicircle.
We at Medicircle are constantly working on bringing to our audience all the trending health-related topics. It is our primary objective to bring to your attention news and views you need to be aware of to lead a healthy, disease-free life. To help us in this regard, we'd be joined by eminent and expert top doctors from across the country. Today in Doctor Speak, we are going to talk about the problem of diabetes and ways to help you deal with it. Hello, this is Aprajita Mehra, and you're watching Medicircle. Today on our Diabetes Awareness series, we have Dr. Pradeep Talwalkar with us. Dr. Pradeep Talwalkar has been practicing diabetology for 3 decades now. He has completed his MBBS and MD from Grant Medical College, Mumbai in 1973 and 1976. He is practicing at Talwalkar Diabetes Clinic, Dadar West. He has lectured extensively all over India. He has attended numerous international conferences on diabetes and visited several centers of excellence in the field. He actively participates in all conferences of the International Diabetes Federation. It is our privilege and pleasure both to welcome him today on Medicircle. Hello, sir. Dr. Pradeep, we welcome you today. How are you, sir?
Hi, Prajakta.
Fantastic. So moving on to our interview and the topic for today, diabetes. My first question to you would be, sir, are blood sugar and diabetes the same thing?
No, Prajakta, there is some difference between diabetes and blood pressure. Diabetes is a disease and it's a cause for rise of blood sugar or blood glucose. Before I start, just one clarification. The specific kind of sugar which is raised in diabetes is known as glucose. There are many kinds of sugar, but all said and done, 99% of the sugar in body is glucose. And in diabetes, glucose is raised. It becomes above normal. It's above normal. Diabetes is a disease due to affection of various organs, principally pancreas, resulting into less production of insulin or less effect of insulin, which is produced in a sufficient quantity, but which is ineffective. As a result of which, the blood glucose, which is colloquially known as blood sugar, rises. In a normal person, fasting blood glucose is less than 100 milligrams per cent. And 2 hours after ingesting 75 grams of glucose, the blood glucose never is above 140. If the post-glucose blood glucose is above 140, or if a fasting blood glucose is more than 100, it is usually considered as diabetes. But to be on a safer side and not to unnecessarily label the borderline people as diabetic, to make a pakka diagnosis, you must have a post-glucose blood sugar of more than 200 or fasting blood glucose or of more than 126 for diagnosis of diabetes. You don't have to have both of them above that particular range. So diabetes is a disease and rise in blood sugar is a result of that disease.
That was really very well explained. And I guess almost all our audience would now appreciate the difference between the two better. So my next question to you would be, sir, are thyroid and diabetes problems related to each other in any way?
Yes, there are to some extent interrelated with each other. Even though the exact fine mechanisms through which they are interrelated is not known, and there is not one, probably there are many mechanisms. What is known very clearly is thyroid disorders are more common in diabetes, and diabetes is more common in people with thyroid disorders. Now, let me give you some statistics. Globally, if you go by the research done in Western countries, about 5% of the people in general population have a hypothyroidism, a kind of thyroid disease which is more common than the excessive function of thyroid gland. The disease resulting from excessive function is known as hyperthyroidism, and disease resulting from low function, low hormone levels is known as hypothyroidism. Hypothyroidism being more common than hyperthyroidism. Both hypo and hyperthyroidism are closely associated with diabetes and their prevalence. That means the likelihood of somebody having these disorders is higher in a diabetic person in a community as compared to a person who doesn't have diabetes. In the Western countries,
Right.
the statistics shows that about 5% of the people in the
Mhm.
general population have hypothyroidism, but that proportion goes up. In our country, one of the papers states that 1 in 10% of the people in our country are hypothyroid. Of course, most of them are mildly hypothyroid and they are never knowing that they are hypothyroid. But when you do some investigations, this mild hypothyroidism comes out. So when you include all this, we have about 10% prevalence, or 10% of the population is hypothyroid. And this context, I'm glad to tell you that I myself, as a principal investigator, did a big research project. We were a large number of doctors. I led them for a big pan-India research project in the year 2019. And we
How
found that
wonderful, sir.
25% of our type 2 diabetic patients are hypothyroid. 25% of our type 2 diabetic patients had hypothyroidism. 28% of our hypertensive patients, those with a high blood pressure, have hypothyroidism. Similarly, hyperthyroidism also is more common in diabetic population as compared to non-diabetic population. So overall, thyroid disorders are more common. Now, let me tell you the two common types of diabetes are type 2 diabetes, the plain simple vanilla type of diabetes, which is present in 96% of the diabetics which affects Indian patients, and type 1 diabetes. Actually, type 1 diabetes, which affects about 2% of the Indians, is a comparatively rare disease, but its association with thyroid disorders is much stronger than the association of type 2 diabetes and thyroid disorders. The reason is very clear. Type 1 diabetes is an autoimmune disease, and hypothyroidism is also commonest cause of hypothyroidism again is autoimmunity. That means what happens is the body's defense cells are confused and they consider body's own thyroid cell or in beta cells in pancreas as foreign cells, invading cells, and they kill them thinking that is an invader. And the disease occurs because that organ is destroyed. Both being autoimmune disorders, both having the same underlying factor responsible for destruction of organs. Type 1 diabetes is more common with hypothyroidism, but both hypo and hyper are more common in diabetes. And diabetes is more common in thyroid disorders. If you have a diabetes, your thyroid disorders do not progress equally well as compared to those who do not have diabetes. And similarly, if you have a thyroid disorder, your diabetes, the treatment is slightly more difficult. Diabetes treatment is slightly more difficult as compared to those who do not have thyroid disorder.
So, sir, moving on to the third question, is there a permanent cure for diabetes? Considering how serious and so prevalent it is in our society these days.
You see, diabetes is a lifestyle disorder. When I say diabetes, now I'm talking about type 2 diabetes, which is 96% of the diabetes in our country.
Right.
This is
Okay.
classified as a lifestyle disorders, along with blood pressure, along with obesity, along with heart disease, along with high cholesterol. This is because of our faults, the wrong way in which we eat, the wrong way in which we live, no exercise, automation. I'll tell you one, I'll give you a quotation given by one Australian scientist. He says, industrialization and Coca-Colization and urbanization has ruined civilization. Urbanization, rural folks coming in urban cities, nuclear families, increased tension, increased stress, wrong eating, ready-made foods, high calorie junk foods, Coca-Colas, stress, some instruments for everything. We don't climb. We have elevators, we have escalators, we have mixers, we have grinders, we have vacuum cleaners, we have automobiles, no physical exercise. That leads to diabetes. So these kind of diseases usually once fully settled, usually don't have cure. To consider that state that I can cure diabetes is actually an offense. You can't do that. You cannot.
And I absolutely second the scientist opinion. We have ruined our own lives because the fact that the body needs to work, the metabolism has to work to, function, our all bodily organs. And that is what we have tried to do, replace ourselves with robots, with machines. And now we are, constantly in the struggle that we are not working enough, and naturally we are falling sick more often.
Okay, I'll give you one classical clue here. If you come across an advertisement claiming cure for diabetes, as I said, it's an offense in India and one can go to the jail if you do that. Then why so many people, you cannot, as per Indian laws, you cannot advertise cure for diabetes and similar diseases. So if you get an advertisement of a product which is claiming cure, and you will wonder what Dr. Talwalkar was saying, he doesn't know information. But mind you, that product is officially not classified as a medicine, as a drug. Its official license is food product, like biscuits, like cakes, like pastries. And that's why they can do it. So that means it's useless. Only food product or non-drug product can be advertised, and then such a product claims to cure diabetes, and still the fellow is not punished, means the product is licensed as food, which means that product has no medicinal properties, as simple as that. So diabetes cannot be cured. There are always some exceptions. If you are a young person with a weight of 110 kg and your blood sugar is basically because of very, very faulty lifestyles, and then you improve and you shed 20 kgs of weight, or you do bariatric surgery and you shed 30 kgs of weight or 40 kgs of weight, as long as that weight is reduced, you don't require any medicines. In that sense, still we can't use a word cure. There are certain other words to be used in official languages of doctors, but not cure.
So you have absolutely, cleared this confusion in all our audience mind, and, broken the myth here that there is no permanent cure for diabetes. It is a lifestyle disease, and we can just about control or manage it somehow as long as you have it. So moving on to the last question of this interview, and I won't keep you away from your patients anymore. So my question is, sir, that does diabetes affect kidneys, eyes, or largely other body parts as well?
Yes, diabetes affects many body parts, and that affection is through the affection of blood vessels. You see, each and every cell in the body requires oxygen for maintenance of health. Now, oxygen is taken to these organs or provided to these organs by the blood vessels, which are like pipes coming from the heart and carrying oxygen through the blood to various organs, and also nutrition, oxygen and nutrition. In diabetes, the blood vessels are affected. Diabetes is very much a disease of blood vessels as much as it's a disease of endocrine organ. So the internal lining of the blood vessels is damaged and resulting into a narrower internal diameter and leaking of the blood from inside the blood vessels to the outside the blood vessel in the environment. The major blood vessels, the big pipes, which are affected in diabetes, the three organs are affected because of this. The big blood vessels going to the heart are affected, leading you to higher chances of heart attacks, which are 2 to 4 times more common in diabetics as compared to non-diabetics. The major arteries to the brain are affected. They are thickened from inside. Their internal diameter is narrowed, resulting into higher chances of strokes and other vascular brain disorders, which are 4 times more common in diabetics as compared to non-diabetics. And also the major blood vessels going to the lower limb, the feet and the lower legs, if they are affected and the disease is not checked, goes on, and particularly if it is also associated with high blood pressure and high cholesterol, then blood supply to the toes and the feet is so much interfered that ultimately it's cut off, and ultimately patient gets a gangrene. It starts with a gangrene of toe, then it spreads to gangrene of other toes, then it spreads upwards, and some people, they have to lose only one toe, but that's for the time being. After some years, they lose other toes and ultimately the entire leg. So this is because of the blood vessel, the disease of the large blood vessel, which occurs in a diabetic person if a blood glucose is continuously not controlled, and particularly associated with very high cholesterol and very high blood pressure. So these three things together, high cholesterol, high sugar, high blood pressure, leads to higher chances of heart attack, higher chances of brain stroke, and higher chances of gangrene. But if you have affection of the smaller microscopic blood vessels, particularly blood vessels going to the eyes, blood vessels going to the kidneys, and blood vessels going to the nerves, then you get disorders which affect eyes, kidneys, and nerves. Affection of eyes, if kept unchecked, if goes unchecked, will ultimately can lead to blindness. And in most of the people in advanced countries, not even advanced countries, in any country which is not very poor and where vitamin A deficiency is corrected, the commonest cause of blindness is diabetes. Any country, whether it's high income, low income, middle income, the commonest cause of kidney failure, ultimately requiring dialysis or kidney transplantation, is again diabetes. More than 50% of the people undergoing dialysis at various centers in our country are having diabetes. Diabetes is the principal cause of their kidney failure. And many people with tingling and numbness and unpleasant sensations in the feet and legs and toes, ultimately leading to lack of sensation, ultimately making them much more prone to gangrene. They are suffering from diabetes. The commonest cause of peripheral neuropathy is diabetes, which ultimately contributes towards the gangrene. The commonest cause of kidney failure is diabetes. The commonest cause of blindness is diabetes. Besides that, urinary infections are more common, fungal infections are more common, gallbladder infections are more common, obesity is more common, tuberculosis and diabetes, if they go together, the outcomes are poor. Even in COVID patient, it has been clearly shown that if a diabetic gets COVID, he is more likely to get severe COVID, he is more likely to get hospitalization, he is more likely to remain for a long time in hospital, he is more likely to go on ventilator, and he is more likely to die from COVID as compared to those who do not have diabetes. So that's why diabetes has to be always controlled day in and day out. And one has to remember that diabetes is a silent disease. Some of us call it chuparustam. Why chuparustam? Because apparently it doesn't produce any symptoms for a very long time. And say blood sugar of 150 and post-blood sugar of 200 will be absolutely silent, but slowly but surely it is eating into various organs of the body. And by the time patient comes to know about it, it's because of the symptom of a disease of an organ which is affected because of diabetes. Say, for example, somebody gets an heart attack. When he goes to the cardiologist will always do blood sugar as on the day one itself, immediately after admission, as a part and parcel of investigation, and he will find that the sugar is high and diabetes was indirectly responsible for that heart attack. Similarly, with swelling of feet and high blood pressure and nausea and vomiting and no appetite, somebody goes to nephrologist, his serum creatinine is 6, the nephrologist said it's too late now, you'll require a dialysis, that's the only way to keep you alive. And the cause of the renal failure is diabetes. So this is how it occurs. This is how one has to keep on constantly on the lookout for diabetes. In our country, once you cross 30, you have to do blood sugar, no matter outwardly how healthy you feel yourself. And even if it is plump normal, every 2 years, you keep on repeating the blood sugar throughout your life. Once you have diabetes, don't rely on lack of symptoms. Whether you have symptoms or not, keep on doing blood glucose periodically, at least once every 3 months, to see whether you are on course, to see whether your drugs are correct, you see whether you require additional dietary inputs or additional exercise. And remember one thing, unfortunately, diabetes is a disease which is progressive. What do you mean by progressive nature of the disease? That as the time goes away, as you become older and older, the internal severity of diabetes keeps on increasing. So you have to keep a pace with diabetes, to still control diabetes in spite of its progression. One has to use more and more drugs, higher and higher dosages, combination of various drugs, ultimately insulin, then more stringent use of insulin, 3 times a day insulin, and so on and so forth. Then only you can control blood glucose. What worked yesterday will not work tomorrow. What works in A will not work in B. Just because A does not require insulin, you should not think that my doctor also should stop insulin. Every person is different, his requirements are different, and his requirements also keep on changing. So let doctor analyze you, do your blood sugars, do your kidney functions, do your end organ assessment to find out whether there are any complications. If so, start treating the complications along with the treatment of blood glucose, and that will give you a better quality life, higher quality life, and that will give you longevity. In today's world, people just don't want longevity. They want high quality life. Dependent life is of no use in old age. Half the people's sons and daughters are in USA, so you have to be independent.
You have to be taking care of yourself. That's so important these days.
So it is very important to tightly control blood glucose. You know, a diabetic patient should remember A, B, C. I'll simply explain you what is this A, B, C. Nowadays, there is a better measure of assessing diabetes in addition to blood sugar, and that is known as glycosylated hemoglobin, and its full form is HbA1c. That A is capital even though it comes in between. So a short form of HbA1c is just capital letter A, which is a measure of diabetes control or blood sugar control. So your A should be always lesser than 7. If you are very young, it should be lesser than 6.5. B means blood pressure. Your blood pressure should always be less than 130/80. And C means cholesterol. There are various cholesterols. The components of cholesterol, the most important component being what is called as LDL cholesterol. LDL cholesterol should be less than 100 if you don't have any heart disease or other complications. But if you have those, then LDL cholesterol should be less than 70. So LDL less than 70, that is C, blood pressure less than 130/80, that is B, and HbA1c less than 7. Only control of blood sugar doesn't help, particularly to prevent heart attacks and strokes, where the control of blood pressure and control of cholesterol is equally important. You just cannot take your army and win the war. You have to have army, navy, and air force. You just cannot score runs and win the cricket match. Once you score the runs, your fielder should defend. They should not, and your bowlers should bowl properly. They should bowl tightly. The fielder should defend tightly.
Absolutely correct. Right.
Only batting doesn't win you. We had Tendulkar, but our winning rate was 10%. Now our winning rate is 90% because they are more of athletes rather than cricketers. They are very powerful. They run fast. They bowl fast.
Correct. Absolutely true, sir. And listening to you, I have realized that the gravity of and seriousness of this disease has actually, required us to bring in this series for, benefit of all our audience. And I'm so glad that we had such a seasoned, such a senior most doctor today joining with us on Medicircle. So I am so thankful to you, sir, for joining us today on this show, sharing your valuable time and insights. So I would like to actually, thank you on behalf of everyone here, at Medicircle. It was really a pleasure having you today. Thank you so much. You have been so insightful, so delightful. Thank you so much, sir.
Thanks, Prajakta. Hopefully these deliberations would be of help to the armed army of our country.
Absolutely. Let's all keep our fingers crossed and let's realize that the importance of this disease and let's do something about it. Thank you so much, sir. The name is Aparajita. I hope you would remember me by that name now, not Prajakta. But thank you so much. Lovely meeting you today. Thank you. I learned so much from you, sir. Thank you, sir. Have a good day ahead. Bye-bye.
Thank you. Bye.